So good morning and a very warm welcome to this plenary session where we'll be showcasing how social care research can influence policy and practice. So we have an esteemed panel from academia and from Social Care Wales who will be reflecting on their own work and celebrating the impact that that work has had. So this first session presents an opportunity to explore the evolving relationship between social care research and real-world impact, to reflect on how evidence has shaped policy decisions, how it's improved service delivery, and how it's empowered communities both here in Wales and beyond. So our speakers include Donald Forrester, who's based at Cardiff University, whose research has transformed child and family social care practice. We're also joined by Rachel Schofield from Social Care Wales, who's championing knowledge mobilisation in practice. And we're also joined by Paul Willis from Cardiff University, who's taken a leading role in advancing adult social care research. So together, our panel members will discuss how research has influenced policy and practice in social care over the last 10 years. They will include some practical examples, some of the lessons that they've learned, the challenges that they've faced along the way, and they will also reflect on the potential for future research to influence inclusive, responsive, and sustainable social care systems going forward. So expect to hear about some bold ideas, some practical insights, and some ambitions for the next 10 years. There'll hopefully be time at the end for our audience here and for colleagues who are joining us online to reflect on the discussions and to ask some questions. So without further ado, I'd like to invite our panel members to join me on the stage. And if I could first of all ask you to briefly introduce yourselves. Thank you.
Do we have a mic?
Oh, you do? Yeah, I've got it.
Hello. My name's Donald Forrester. I'm the director of Cascade Children's Social Care Centre at Cardiff and also the deputy director of Scale, which has been already mentioned, is a new centre looking at AI and social care. I've certainly been doing research for 25 years. I'm very dubious about whether I've transformed children's social care, but I've done my best, and hopefully we can talk about both achievements and failures in relation to that.
Hi, thank you. My name is Rachel Schofield. I'm the head of knowledge mobilisation in Social Care Wales. I'm a registered social worker for over 20 years. My practice experience is over children's and adult services, working predominantly in the field of substance use. From that experience, I have brought my passion for working in an evidence-informed manner into Social Care Wales and into the knowledge mobilisation role. So thank you.
Hello everybody, my name's Paul Willis. I'm Professor of Social Care at Cardiff University and I'm the Director of the Centre for Adult Social Care Research. I qualified as a social worker quite a few years ago in Australia. I used to be a children's social worker in schools. In the last 15 years over here in the UK, I've moved into the adult social care research space. So I'm looking forward to giving hopefully a kind of warts and all account of trying to put research into impact, into practice and policy.
Okay, thank you. So the first question this morning is for yourself, Donald, and I'd like you to look back over the last 10 years and share with us what you think is the most significant example of where social care research has influenced policy and practice in Wales.
Nice easy one to start with. I feel a bit like when my children were younger, they would, I think, jokingly argue amongst themselves about which one of them was my favourite. And we've done lots of projects, and I don't know if I've got one that has had the most impact, but I am going to answer the question because it would be rude not to. And the one I'm going to talk about was called the Looked After Children's Education Project. I'm going to talk about it because it had an impact on me or our family, which is a very subjective reason for choosing it. But I also think it had an impact on lots of other people. About 4 years ago, we became foster carers. And that meant that I had the experience of being on the other side, if you like, of the practice-research divide. And one of the great things about that was actually seeing quite a few times when Cascade's work had an influence that I saw as positive. And one of those times was we were trying very hard to get our foster kids into the local school, and the headmaster was saying, the classes are all full, you can't get in. And I was able to go to the Welsh policy that had been written based on that project that said, you're not allowed to do that. Looked after children's education is not good enough, it needs to be a priority, and even if classes are over 30, children need to be allowed in. So for me it had a very direct impact. I am sure it wasn't just on our family, I think it's had a much more broad spread impact. And what I loved about that research is it grew out of a close engagement with the sector, but particularly children and young people, led by Dawn Manny, originally by Sally Holland, who went off to be Children's Commissioner. It put listening to and working with children and young people to find out what was important to them at the heart of the whole project. So that meant designing the project, using creative methods to find out their views, and then involving them in sharing and disseminating the research. So that when you read the research, it's not just what can sometimes be arid sort of research findings. It was brought alive with quotes and even pictures and other things done by the young people. It changed policy, but I think you can also see in our family it also changed the lives of many children and foster carers and others. So I'll give that as an example, but it is just one of many.
Yeah, and a really good example of how it shaped policy and the importance of hearing the voices of children and young people.
Yeah, so.
Thank you. Okay, so moving over to Rachel. Reflecting on your experiences, could you say a little bit about what we've learned about how research currently influences policy and practice in social care? And I guess also crucially, how we can use this experience going forward to do better.
So I think something from a practice experience and then coming into Social Care Wales, there is evidence of research shaping service design and service delivery. And I think there are small pockets of that being undertaken, but I think it's a different conversation for different aspects within the sector. I think what we often see is that a research culture is usually driven by interested individuals, people who are passionate about that, rather than it being embedded within the infrastructure within social care. So it becomes sort of a thing that's good to have rather than the essential. So I think we can learn on that, and by looking at sort of embracing those people who are passionate and learning from all of the positive examples that we do have within Wales, and those journeys that we can create for people. Myself, I was a consultant social worker, had the opportunity to have a little bit of free time. Not free time, that sounded very wrong. Having a little bit of protected time to explore my interest of research-informed practice. That then opened my doors up to being involved with NICE, which then led me to be involved with the NIHR, which then brought me to this role within Social Care Wales. And without that opportunity to take my head up from the front-facing social work, those opportunities would never have been there for me. So I think there's the way that we do use research to shape our culture and our decision making and our policy, but we probably need to open that door for more people to be involved within that journey, to be a part of that. And within my world, coming through as the knowledge mobilisation lead, it's ensuring that the research that we are using is meaningful. So we do a lot of work with our colleagues in Cascade and Care, and with independent research that's being undertaken to help ensure that social care and social care voices are part of that co-creation In Social Care Wales, we have our evidence offer, which is more than, we know that we can't just go, here's a piece of research and leaving it there with people. We know we need to have an engagement of that knowledge and sharing that and reflecting upon it and challenging it as well sometimes in what part of that is missing for my practice. And that's how we focus our work within Social Care Wales and within my knowledge mobilisation team and within the research team that we have within Social Care Wales. We work so closely together to ensure that we are using the same language. I think when I came over from practice, I'd undertaken a piece of research with the NIHR, but I was so nervous about the language, talking about doing interviews with people. And I was like, oh, but that's what I would do for my bread and butter. I'd have probably 8 interviews with people a day, going to different home visits, and bringing all of those skills around quick analysis and reflection and capturing people's voices. So we do a lot of work within our team to ensure that academics and social care are starting to come together on the same language going forward. And we do different ways of providing that in Social Care Wales to help shape policy. We undertake the workforce survey, which is the Have Your Say survey, which is a national survey looking across social care for practitioners to give us their opinions and how they're feeling about their work. And that's going to be published on the 12th of November of this year's one. So that's a date to look out for. And we know that that survey is really instrumental in helping Welsh Government and research partners in looking at where those topic areas are. We also undertake workforce data collection. And that's created in our Data Insight series, which is all on, I should have said at the beginning, everything I'm talking about is available on the Social Care Wales Insight Collective website, which is an open access website where you can see everything that we do about knowledge, research and data. So within the data portal, we collect the data, but I think the important thing that we do is we then analyse that as well and bring that down into, again, the language and to make it meaningful. With our research team, we also create evidence summaries where we look to take some of the leading pieces of research on a topic. We analyse that and we pull out the key messages for practice as well, so that research becomes accessible for people. And then if things are accessible, it is used more, and then policy and service delivery is shaped from that. So I think that's...
Okay, thank you. And you mentioned the co-creation offer. Can you say a little bit more about that, what it involves and the benefits of that approach?
Yeah, so co-creation is where we work with, we undertake a similar priority setting exercise as we've heard about with Healthcare Research Wales, where we work with citizens who use social care services, with practitioners, with academics, and we hold a series of workshops and stakeholder sessions to talk about what is important for them. That then gets refined, and we end up then with a list of about 10 to 15 priorities for social care. From that priorities list, we know that that is what the social care sector is telling us we need to be getting better at delivering information on. That is available for researchers and partners to use to shape research questions in bids going forward and into the future. We also look at that and think, well, what do we actually currently have to try and cut down some of the repetition as well. We do have really good quality social care research out there. So part of my research team colleagues' role is to look at finding the research that is available on that, and that is where the evidence summaries come from, because we know that that is something that the sector is crying out for. Within my knowledge mobilisation team, we then look to take that topic, potentially an evidence summary, to the workforce. So with all of our relationships that we have with different partners, local authorities or teams will say, we really need to do this. We'll go out, we'll take that piece of research, we'll do a reflecting on evidence session and break it down and make it actually meaningful for practice. A recent example of that from the priority setting has been on transitions from children to adults. Out of that came a discussion around transitional safeguarding. So we've had evidence summaries written around that transition process. We then found out that transitional safeguarding was a major ask from the sector. My team then host research roadshows where we look to bring on board some of the lead researchers to come to us. We've now been asked to present that across all of the regional safeguarding boards across Wales, because there's this ask for a national conversation. So we're helping to facilitate that to ensure that all regional safeguarding boards have had the same access, the same opportunity to come together and work, and working with the National Independent Safeguarding Board to sort of take that further. And that's all come through the priority setting and that co-creation. But it's really important that it goes back round again then, so that the people who have been involved in that work hear about it and are involved in the delivery and the outcomes and understand the impact that is having.
Okay, so thank you, and really good example of research and practice collaboration there. Okay, so I'd like to move on now to Paul and ask, we know about some of the challenges associated with the uptake of evidence into practice. We know that this can be very complex and very challenging. So can you tell us, in the context of adult social care, how researchers can perhaps overcome some of these barriers that often prevent their work being translated into practice? How can we address this? Do you have any examples from your own work that you can share with us?
Sure, thanks Diane. A few thoughts, 3 things that stand out to me. I think first of all it's about stakeholder engagement early on in the process. So that early point from problem definition onwards and laying down the research questions, identifying early who the key stakeholders are, and then investing in those relationships over a long-term period. An example would be my care colleague, Georgie Powell, who for a long time has been working with housing providers about implementing smart technology into housing that supports people with learning disabilities to support independence and independent living. So more recently, Georgie has worked with a housing provider in South Wales who have used the handbook that's developed from her research and have now developed custom-built homes for people with learning disabilities that have embedded the learning from her project and the smart tech into the project. And that's on the back of that kind of long-term engagement and work and collaboration and investment from both the housing providers and from Georgie as the researcher leading that work. And early next year, Georgie is starting a new 2-year project on a bigger scale, carrying out a realist evaluation of the implementation and use of smart technology across homes for people with learning disabilities and also older people in terms of supporting independence. So part of our ongoing longer story. I think it's about also having the right stakeholders around the table that makes a difference. That's really critical to get that right from the beginning. And to give an example, recently I was fortunate to be part of a project focusing on raising the visibility of what social workers do when they support older people in the community. And that was led by Denise Tanner at University of Birmingham, and in collaboration with myself and in collaboration with the British Association of Social Workers and Research in Practice, both are key organisations. So having those 2 organisations on board was critical for that research. And it was also about the right groups. So we had a experts by experience group, which was predominantly older people, who had experience of accessing social work support and receiving social care support. We had a policy advisory group, which included people at that higher level, including representatives from the British Association of Social Workers and directors of social services. And then we had local advisory groups at the actual research sites, which included lead social workers, senior social workers from those local authorities, and again, people with lived experience from those communities who had received social work support, including carers. So having that alignment across all those different tiers really helped to lead to some impactful work. So to give 2 examples on the back of that project, the British Association of Social Workers has now established a special interest group focused on taking forward the work about raising the visibility of social work of older people, or what we call gerontological social work, and that includes our members with lived experience. So that work's carrying on in that policy space, And we've continued to work with a local authority in England who are taking forward the recommendations from that project. So one of the recommendations from that project, and one of the clear findings that stood out, was that older people, carers, and social workers and other professionals valued continuity. They wanted the same social worker. And when they had a different social worker or changes in social worker, that disrupted the relationship, and people felt like they had to go back to scratch. So one of the key findings that a local authority is currently working on is how they restructure the way they allocate cases, how they plan and provision resources in terms of social work time and input, so they can achieve greater continuity in social work allocation to older people and their families. And they're moving forward with plans for a named social worker for social work of older people, which is fairly unique.
Yeah, and I think you're so right there about having the right stakeholders around the table and at the right time as well, from the project development stage right through the project life cycle and to your knowledge exchange and your uptake of evidence into practice activities. So thank you. So moving back to yourself now, Donald, what strategies can researchers use to address the challenges in children's social care that limit real-world relevance and application of research findings?
I suppose it picks up on some of the things that both Paul and Rachel were talking about, which is we talk a lot in social work about relationship-based practice, but actually I think in an applied discipline like ours, we have to have relationship-based research. And the best research, and I'll give some examples of this, starts out with relationships with practitioners, policymakers, or those who receive services. It involves them throughout, not just in designing the research, often in delivering it and then sharing findings, because I find there is no one better to get across the message of research than someone who's got direct experience of having lived through that. So I think building those relationships, sustaining those relationships is at the heart of all the good research that we've done. So just to give a couple of examples, just from recently, of research proposals. I don't even know if we're going to get funded for these, fingers crossed. I was fortunate enough to be invited to facilitate a meeting by the Welsh Government of all Wales Heads of Children's Social Care earlier this year. And one of the issues that came up there was an issue about data and how they would like certain types of data. We developed with them a research proposal to give them answers to the questions that they needed to have answered. So that's the point, I think, is you need to develop relationships with the sector so that you know what they need constantly. Another example of a project which is based in England is the provision of therapy to parents during care proceedings. Psychological therapies, often not given to parents, despite the fact that mental health issues are the single biggest reason why kids are coming into care these days. Conversations with practitioners, realizing this is beginning to happen on the ground, but we don't know the impact it has. Now we're developing research to evaluate that. But did you ask for an example? Anyway, I'll give you another example, because
Carry on.
but I wasn't sure which to pick as my favorite project, because I've got several others, but another one that illustrates this is Louise Roberts' work around children, care experienced young people who have a child, who have a baby. She was doing work with our public involvement group, and it's great to see Rachel and Josie here, and we are blessed. Because, I don't want to suck up too much to our funders, Healthcare Research Wales, but I'm going to. But because we have infrastructure funding, we are able to employ people who can work with young people and parents who've lived experience of services in a way that no other centre in the UK is able to do, which means we can put genuine lived experience at the heart of most or all, we hope all of our projects, or certainly a lot of them. And this is an example of when that happens. A couple of the young people we were working with told Louise that they'd had their babies removed. And Louise thought, she heard about the pain it caused them, but she thought at some fundamental level, this is a terrible thing, because we are responsible for those young people. We've taken them into care, so there's a sense in which they're our children, and then we're removing their children. I'm not saying that should never happen, but I'm saying we should bend every sinew we can to avoid having to do that. She carried out some research to find out how common that was. And reading that paper is which was it was a purely an academic paper. It didn't use emotive language. It is the only time I've ever cried while reading a research paper, because what she discovered is that about a quarter of children leaving care, if they have a child, about a quarter of those children are removed from them, which is a horrifying statistic, in my opinion. But she didn't leave it there. She worked to co-produce with young people ideas about best practice and ultimately a charter for best practice to avoid looking at risk and try to provide support for these young people, which has now been taken on by all the local authorities in Wales, many in England, and there's now international interest in that. So she's been doing that work for 8 years, and what it illustrates for me is that really good research that makes a difference is about sustained relationships with the people who receive services, the people who deliver services, and researchers, so that we can understand problems, we can develop appropriate research, we can try out solutions. The solutions may not work first time, so it may take quite a while to be developing the best possible solutions. So we need to have sustained relationships to create really good research that makes a difference. So that's my answer.
That's a really impactful example. Yeah, and you mentioned the importance of building and sustaining relationships. Can you say a little bit about some of the challenges that are maybe associated with doing that?
Yeah, well, I could. In fact, Rachel, who's somewhere out there, would be a better person to talk about that because she leads on this. There are many potential challenges. And I suppose there's different constituencies that we will be working with. So to think about some of the different groups. In the world of children's social care, so public involvement, patient involvement is a big thing in health. The children and young people we work with and the parents we work with tend to be amongst the groups with the highest levels of difficulties in society. There is a reason why children have been taken into care. There's a reason why perhaps the parents have had children removed. And therefore, you need a really sensitive, and again, it's about the word sustained relationship building that isn't just about having a meeting, finding out what they think is important, but is about understanding and working with them and having a relationship with them in the long term. I think that's at the heart of Cascade's philosophy about public involvement, thanks to the work of Rachel, who is, and others who are here. So that's an additional challenge. I think some of the problems in practice and policy are about the pressures those people are under. So policymakers often need to produce something very quickly. We were involved in setting up the What Works Centre in England, which is a very big national initiative. But they would come to us and say, well, could you find out what works and run a big randomized control trial in 18 months? And you think, well, you know, that's just completely unrealistic. But from their point of view, the politician or the policymaker will often want results very quickly. And then in practice, and again, I suppose this, reflecting back on my experiences as a foster carer to illustrate this, we are often thinking about what is best practice, what would be the best possible way of working with families. In reality, you have social workers who've got too many cases to work with, they're under huge pressure, they don't have time, there's a high turnover, and some of those practical issues can make actually applying research or research findings, or even thinking about research, which you were sort of touching on, really difficult. So we need to really be aware of the high-pressured environment people are working in, and particularly thinking about how we can address some of those pressures.
Okay, thank you.
Thanks.
And so moving back to you now, Paul, we've heard about the importance of relationships, and I wondered if you could perhaps reflect on the role of co-production, and in particular how people with living experience can make research more relevant and more impactful.
Yeah, well, Donald's already given some fantastic examples there, and I'll add to that. So over the last 10 years, I've been part and led a couple of projects where we've worked with co-researchers, older people with lived experience of the issues that we're seeking to address through the research. And as co-researchers, we've supported those older people to develop skills in interviewing, and making sense of interview data, and then those older people have gone out into the field, if you like, and carried out a whole range of interviews with people working in care homes, with social workers and other people working in adult social care departments and local authorities. And I've always been struck with that approach about how much of a difference it makes in terms of amplifying the relevance of the research. And we've supported some of those co-researchers to present work. And again, I've always been really struck by how differently people in the audience listen when a person with lived experience talks about the same research that I'm talking about. And perhaps that's just because I'm very boring and dry, but anyway, they bring it to life. Thanks, Donald. They bring it to life in a whole different way, and people listen in a whole different way. So for a couple of years ago, we supported a group of older people who've been part of a research project looking at LGBT inclusion in social work assessments and social care assessments. And we supported that group of older people to go to an international social work conference and present their experiences of the project. We all went up to Edinburgh for this conference. It was standing room only for their actual session. And I'd never seen an audience so attentive and so enraptured by what people had to say. So I think it's a really powerful way of conveying key messages to the right audiences, but it's also a fantastic way of equipping those people with skills and capacity. So we've supported some of those older people who are now co-researchers on other funded studies, looking at issues around ageing and ageism and intersections with homophobia and disableism and transphobia. So it's had ongoing legacy, and it's just a joy to be able to work with people in that way who are very passionate and share the same passion. And I think sometimes co-production can happen accidentally as well. I've been part of a project where about 10 years ago we had funding from Comic Relief to, they were implementing a project in a group of care homes in England where we worked with older LGBTQ plus people who were going to be pairs, and they were going to go into each care home and do an evaluation, like an audit of how LGBT inclusive these care homes were. And we were part of the research team. We were going to evaluate, a soft evaluation of the outcomes from this particular project. And we kind of made the assumption, because the care home provider and the managers were so welcoming and on board, that the care home staff would be. And our brave volunteers went into the care home and then came back aghast with stories of quite some harrowing conversations that had with care home staff about inclusion and about supporting older LGBT residents. And they said, you need to halt your evaluation, we need to do some training. We go back and do training, and we'll do it. We'll do the training, we'll front it, if you give us the right skills and resources to do the training. So we changed tact. We took a co-production turn, if you like, on the back of their advice as community members. We put a pause on the evaluation work. We gave them training in terms of, these are the resources, these are ways of doing awareness raising, addressing some of these attitudes, and then they went in and had these fantastic conversations, hard conversations, but fantastic conversations that led to much greater impact, I think, than what we initially set out to do in creating this audit program through community member-led work.
Okay, so really excellent example of co-productive work in there. Can you maybe reflect on some of the challenges that raises as well?
Well, one of the challenges is all of our projects that were mentioned are only funded for a period of time, and then you hit that cliff edge where the funding ends. And you've got a fantastic group of co-researchers, for example, who are sitting there and going, okay, what's next? And okay, we're nearing the end of the project, and obviously we support people to prepare for that. But that's a challenge about how you maintain those relationships, how you sustain people's energy and input, and make sure that we don't lose those really valuable groups of people who support the research and co-lead the research in many ways. So that's tricky in terms of the funding landscape and the way that the funding landscape works. It's always in bits and pieces, and there's always that cliff edge. I think that's probably the key challenge.
Okay, and another question either to yourself or to Donald is, can you reflect on how the Health and Care Research Wales support has helped you to involve people? We know that is really crucial and underpins a lot of Health and Care Research Wales work. So if you could say a little bit about the support from Health and Care Research Wales and how that's helped you to work collaboratively with people.
Sure, I'll start with Yeah. So within CARE, the Centre for Adult Social Care Research, we have a fantastic public involvement officer, and we have a fantastic lived experience collective. And there's some members here in the crowd. There they are. Yay! They're giving a wave. So through Healthcare Research Wales core funding, strategic funding that supports the infrastructure of our centre, our public involvement officer, Alice, works with this fantastic group of people who have direct experience of receiving social work and social care support and services. And they're a really diverse group. They bring a whole range of experiences across different age groups, and they work with us in many ways. They work with us in terms of developing research projects, in terms of bidding, and also being public co-applicants as part of that. So the funding and support has enabled that to happen. And they also impact on the policy space as well. So our Lived Experience Collective recently submitted their own response to the Welsh Government's recent consultation on the new disability plan, new disability plan strategy. And I think that's really powerful in terms of being able to feed in their own response, which is driven by people with that direct experience of having a disability and overcoming the kind of many barriers and challenges they experience in day-to-day society. And that work continues, and we're very fortunate to be able to work with that group and support people, and we'll have people here today as part of the conference as well.
Well, I'd sort of partly already answered this question, but it's just to reiterate, picking up on something Paul said. If we don't have kind of core infrastructure funding, then we rely on bids which may or may not come and are often 1, 2, 2.5 years. And that means you do a bit of public involvement and then you don't have any funding, so it drops away. What infrastructure has given us is the capacity to have a small team that can provide sustained building and supporting of relationships. That's the most important thing, but because of that, our research has become much better. Because we're able to have those sustained relationships, we've been more successful in getting the bids and grants, which has been hugely important as well. And I'm just going to sort of put a plug out that the group we work with recently had an article published in the British Journal of Social Work about their experiences, which I think may be shortlisted for a Healthcare Research Wales Award to be announced later today, fingers crossed. But whatever the outcome of that, and I'm sure there are many other very good candidates, it does illustrate, I think, the real sense of co-production. And I think maybe ownership is the word I'm looking for. Many of the people we work with have a sense of ownership. They see the difference that their opinions are making on our research, and they, like us, hope that our research is making a difference out in the real world. So we use the word empowering too much, but that cycle is really potentially very empowering. I've seen it be empowering.
And I think you're right, we are really lucky to have that infrastructure funding here in Wales, and we are the envy of our colleagues in other UK regions, and it really does help us to do some really innovative, meaningful and important engagement work. Okay, thank you. So back to you now, Rachel. I just wondered if you could reflect on how we can better use knowledge to influence policy and practice so that research doesn't just sit in reports or it doesn't just gather dust, but it actively informs day-to-day decision-making in social care practice.
I think between the three of us, we have talked around this, to be honest with you, because I think it's the relationships. It has to be from the people who are going to be using the services. It has to be shaped by them. It has to be relevant. And if we can do all of those things, then the research that we produce and we can use is going to be of that higher quality and to be more meaningful and to be relevant to practice. But there's lots of challenges, I suppose, out there regarding it. Social Care Wales did a piece of research with Sky quite a few years ago now with the practitioners within the sector, looking at the barriers. Everybody is aware that in an ideal world we would be using research and knowledge to influence our policy making and our practice, but the barriers that came out, and nobody will be surprised, was time and access. If you have a workforce that is constantly fighting fires, it is so hard to think of that investment then in a 3-year study, and then to consider what the outcomes might be. If you've got care staff who are constantly having to cover shifts, who are running high sick rate and trying to get the basic care done, looking at what the optimal care can be a real challenge. So with regards to the opportunity of getting that protected time, I think this event and all of us working together goes a long way towards that in trying to help shape the infrastructure just to ensure that it becomes more than a nice to have, but something that is just essential. And we don't need specific job roles to do that, but every job would have that opportunity to have that time to be involved in research and to consider their practice, or within larger organisations who are commissioning social care, is that they have the time and that they expect that there should be research behind the programmes that they're developing. So I think that's something that we can all work together with our relationships and with our relationships with the sector then, and with the citizens who are using that, it will be to shape it going forward. The other aspect that we've helped with within Social Care Wales was with the access. You have access to your universities when you're going through your qualifications. After that, you don't have access to research or to journal articles. The majority of providers, there's a cost incurred into keeping your staff upskilled with that. So that obviously is something that can be set aside in many areas. So Social Care Wales worked with Digital Healthcare Wales to look at the NHS e-library and to consider how that can help support social care. And that's been a massive asset that we can now offer the social care. A large number of social care practitioners can now access a safe and reliable library where they can find appropriate research articles. And the work that we'll be doing with them is looking at shaping that search history, because within social care we've said that people aren't, we don't think about research, within supervisions with line managers. You're never asked what research or evidence are you using behind that decision. It doesn't come up. So thinking about how to actually do an academic search is a massive stumbling block in itself. But with the e-library, we've been able to, they've done all of the work. They've been shaping videos and structures to allow social care access to have that accessibility. And that is something that is then safe and reliable, because we're coming into a world of AI and what can you search and where is that research? Is it appropriate? Is it been peer reviewed? Is it something that you should be putting within your court reports? But by using the e-library, we know that it's a safe and useful resource for people. So I think we're trying to help towards that time conversation, and something that I feel is something we need to be working more on, to ensure that our workforce have everything at their disposal, but also the access is something that we're working on as well.
And I think that e-library is a really good example of how we can encourage practitioners to actually engage more readily with research, isn't it? Yeah.
Absolutely.
Yeah.
Can I also do a plug for Exchange? No, it's fine. That's absolutely fine. So we are really fortunate to have fantastic research centres in Wales, in my opinion, in social care. But we also make a real effort to share findings, not just from us, but just generally about latest developments and research in social care. So the Exchange Network, and they have their stall out there, provide free webinars and other activities, and thousands of practitioners will come and look at those each year. So I just want, particularly as it's funded by Healthcare Research Wales, I thought I'd put a plug in for that. Yeah. But also, if you are involved in social care and don't know about Exchange, sign up. It is free to use, so make use of it.
Okay, thank you. So I've got one final question that I'd like to ask each of you, if that's okay. And that is, what is one change that you would like to see within the next 10 years to try to strengthen that bridge between research, social care policy and social care practice going forward?
Okay. Yep. Fighting for the mic here. For me, I'd love to see more practitioner-led research. And thinking about the next 10 years, an ideal picture would be within 10 years' time that at least 50% of social care research is practitioner-led. And I know Healthcare Research Wales are investing a lot in that space, and the academy that was mentioned earlier, and the various awards that are available to support people in practice, from local authorities, for example, to do further research study, do PhDs, develop their career in terms of research skills. So the groundwork's there. I think we've still got a long way to go, but I think that would be ideal, and an ideal situation where we were really doing co-led research between people based in universities and people in practice.
So I think for myself, probably building on from that wish list, would be to have the sector geared up with the ears on and the skills there to engage with research. So hopefully it would be undertaken by social care practitioners, which would straight away make it more meaningful and relevant. But for the sector as a whole to have the skills and the awareness and the time to be engaged in these conversations, to consider their practice, their commissioning and their policy development. And that would come through having the infrastructure in place across social care to ensure that research becomes, like I said before, just an essential and a given rather than a nice thing to get involved with. So I think that's what I would be looking for. Thank you.
I handed on the microphone because I was thinking of too many. I'll just pick one, which is, I think over the next 10, 20 years, society is going to be transformed in ways that we can only begin to imagine by the application of AI. And that will affect social care as well as many other areas. So my hope, and what we're trying to do in the Scale Centre, is that we can build AI to support practice that is human-centred, that is ethical, that involves the people who receive service fundamentally in how it's created. So that AI isn't just thought of something that will be providing a shortcut. It's something that should be supporting reflective practice that will make research findings more accessible and interpretable, but that needs to do so in a way that isn't oversimplifying or prone to other problems. So what I hope is we have a potential here to address some systemic issues that have been around in the sector for a long time, and our aim at Scale is to harness the potential of AI to really make a difference. So that's my hope.
Okay, thank you. So in our remaining time, there's now opportunity for the audience here in the room and those who are joining us online to ask any questions of the panel. We have a couple of people dotted around the room with roving mics, so if anybody would like to ask a question, just please raise your hand. Couple there.
I know you tapped upon training. As regards to the training for professionals, do you actually have lived experience in the room? As regards to the training side of it, because it can become a tick box exercise with professionals. By having lived experience in the room, it's less clinical.
Yeah, absolutely. Yeah, and that's something that, and unfortunately, within the work that we do, we haven't got the ability to have a lived experience coordinators as my colleagues have here, but it's something that we really do shape within Social Care Wales, as we do have a board with lived experience. But what we do when we are looking at the priority settings, obviously that is engaging with people with lived experience, and then through our work then we look to support those individuals to come with us on that journey. So expressing lived experience in the training that we provide. So within the research roadshows that I spoke about, we have stories that were shared because people didn't feel able to attend on the days, but we've previously had people who do attend, who lead the sessions for us, who tell us the experience that they've been through and how research could or could not have helped them during that time. So it's a real thing, and as Paul was saying, they're the people who know, they're the people that we listen to, and that's so essential, is that we capture those stories and those individuals, and we support them to be a part of those events with us from the very beginning. So yeah, that is something that we aim to do.
Social Care Wales have recently come along and met with members of our Lived Experience Collective in Care, who, and those members have really helpfully input into one of your recent priority setting exercises for research. So I think it's about linking into the existing groups, like the groups that are part of Cascade and Care and other centres. That's, I think, critical, and already doing that.
Hi there, my name's Stephen. I want to ask a question. Well, I got 3 questions in mind from what I heard. How can you make sure that people know their rights? Because when Donald was on about the rights down there, it was very interesting, because a lot of service users and carers and employed staff, for example, don't know rights. Question number 2 is about like discrimination, because you was mentioning like the LGBT community. I've recently experienced discrimination from being autistic. The individual couldn't work with me because I was autistic. So my view is, as someone with lived experience as well, how can we tackle that stigma in a way? And final question is, with someone with psychosis, for example, as well, lived experience with psychosis and autism, how do we get people like myself involved that may have paranoia working with the research sector, for example, for using digital technology, for example, maybe like smartwatches and phones and stuff like that? There you go. Hopefully it's not too much in one go. Oh, yeah, sorry, Michael. Thank you.
The question about raising awareness of discrimination. So I think that's another point about how to make an impact. Going back to some of those earlier questions we were considering and talking to, is about creating really accessible, creative, easily digestible resources that speak to people in the community that you're researching, as well as people in policy and in practice. So I was part of a project called the Trans Ageing and Care in Wales study, which was about building inclusive health and social care for older trans people in Wales, and it was funded by the Dunhill Medical Foundation and Vivencia. And that was co-produced study, and on the back of that study we created a series of short digital stories. We worked with a trans filmmaking company from Brighton, and they worked with just the members. They pushed our researchers out of the room, which was appropriate, creating a comfortable and validating space. And those stories are on YouTube, and they focus on an individual trans member talking about their story about becoming older and their worries about getting older and their experiences of discrimination in the healthcare system, and in social care and housing in various parts of Wales. So they very much raise awareness of their experiences of discrimination and also their rights. So for example, one of those individuals on those digital stories talks about their experience of a GP who begrudgingly decided to support them to access hormones as part of their gender-affirming treatment, but insisted they needed to pay for their prescription. And the pharmacist said to this person, "In Wales, prescriptions are free. You should not be paying for your prescription." And I looked at that digital story the other day on YouTube in preparation for this session, and there are about 60 comments from trans older people around the world speaking about how validating it is hearing this person's story captured in this way and their fight with various people in the healthcare system and some of the barriers that they experienced. And one of the people said, I wrote this down, hopefully I can read my own handwriting. Nope. As an older trans person, I can now see I'm not alone, and at 63, I waited so long to finally be me. Thank you for telling your story. So, I think there are really powerful ways. We need to think creatively about how we translate research findings into outputs, into resources that are powerful, that can be impactful, and indeed need to perhaps invest more time and resourcing into that than the creation of the kind of academic outputs.
Okay, Thank you. I've just been told we are now out of time. So I just wanted to thank our panel members and close by just reflecting on and saying that what a privilege it is to work in Wales and to see the commitment to impactful research that has real world application and that affects positive changes in people's lives both now and will continue to do so in the future. So thank you for your presentations and for your comments today, and thank you also for your questions. Thank you.